The devastating impact of COVID-19 is undermining the very foundations of our societies and economies. It has wreaked havoc in communities all around the world. Our way of life has been completely disrupted. Hundreds of thousands of people have died. Millions have lost their jobs. Trillions of dollars have been lost. I'm particularly sensitive to the impact the crisis is having on the most vulnerable people among us. It has revealed the fragility of the political and trade mechanisms which were established to regulate international relations. When a crisis hits, be it war, disease, or natural disaster, people often run to protect themselves and their loved ones. This crisis is different. We have suddenly found ourselves in the same boat. As much as individualism and nationalism are visible, it has revealed the capacity of people to support each other and to be in solidarity with the weakest among us. We've seen the heroic role of medical staff and many others, most of the time invisible, who are keeping our system functioning. Calls for solidarity are not new, but how successful have we been? Do we all give it the same meaning? Let us be clear. It's not about charity or generosity. I stand in support of the United Nations Secretary General's appeal for solidarity. There is no other option. This is a global crisis. Delay in action means death. We all face the same enemy, and we stand to gain by bringing the full force of humanity together to fight it. There cannot be victory over the virus in one or some countries alone. We all have something to contribute, regardless of the size of our economies or populations. A global solution is in everybody's enlightened self-interest. Essential values of equality, justice, and solidarity should be at the core of whatever we undertake the day after COVID-19. The United Nations is well placed to pull all this together. Let's amplify our voices and multiply our faces. COVID-19 is an equalizer. It doesn't pick and choose its victims. We should respond with humility, solidarity, and empathy. Our focus should continue to be in protecting the most vulnerable, especially women, children, and people with disabilities, as well as the hard-hit informal sector, mainly in Africa. Adapt solutions to our reality. These solutions can be found right here within our communities. They know better how badly their life has been impacted. Start drawing lessons from the crisis with greater attention given to strengthening the public health system and the emergency response mechanism. Join forces to seek equitable access to COVID-19 vaccine, which will not only be an antidote to the virus, but also to the divisions it has revealed. My call for action would be to eradicate the pandemic by mobilizing all necessary resources and knowledge, better global coordination with the United Nations at the center, robust international cooperation, not international competition. Innovate. The same tools will not produce better results. Amplify the voice of developing countries, fair and equitable distribution of future therapies and vaccines.